is Jamison Russell. I'm going to be the nurse here doing your discharge paperwork. Can we start by saying your name and date of birth?
Yes, Matthew Smith. My date of birth is 7/22/1958. I have my daughter and my wife here. We all want to be together for this discharge summary, if that's okay.
Yeah, that's perfectly fine. All right, here's a copy of your discharge summary. We're going to go over this. Okay, so first of all, we're going to talk about the wound care. I understand you have a incision on your right inner thigh.
Yes.
Okay, so when it comes to your incision, we're going to want to keep the incision clean and dry. You're going to want to keep a clean dressing over the incision. All this is to prevent infection. All right, well, next we're going to talk about the medicines, okay? So, see here, you're going to be on lisinopril, 10 milligrams twice a day. That medicine is for lowering your blood pressure. Some side effects will be dizziness, cough, headache, and or high potassium levels. Some instructions for lisinopril would be to take medication around the same time every day. Usually the first dose will be taken around bedtime to prevent dizziness. You're on metoprolol. That's 100 milligrams twice a day. That's also for lowering blood pressure, chest pain, and heart failure. So some side effects you might experience will be tiredness, constipation, bradycardia, which is slow heart rate, rash, or reduced interest in sex. Instructions, you can take this with or after meals. Take the medication around the same time every day, and take the first dose at bedtime to prevent dizziness. Okay, your next medication will be the atorvastatin, 80 milligrams daily, and that's for your cholesterol. Constipation, diarrhea, nausea, fatigue, gas, those are some side effects. You're gonna want to take this medication with or without food. Take it around the same time daily, and do not crush, chew, open, or break these tablets. Your aspirin, 81 milligram daily, that's a blood thinner. So you may experience rash, gastrointestinal ulcers, abdominal pain, upset stomach. You're gonna want to take this medication with a full glass of water. Your clopidogrel, 75 milligrams daily, prevents stroke or heart attack by preventing plaque buildup. Some side effects will be headache, dizziness, nausea, diarrhea, and the instructions you're going to want to take this with or without food. Take your Humalog and cetirizine as prescribed. I have some lifestyle considerations for patients with MI. Reduce salt intake, eat more fruit and vegetables, be physically active, avoid smoking, and limit alcohol consumption. Are there any questions?
Then I have a question about y'all going to Nigeria in a couple weeks.
Yes, we are going to Nigeria in 3 weeks, and I was wondering, is it safe for him to travel?
Travel out of the country should be, within 3 to 4 weeks. To give that, give the time of recovery. The stent.
Get back serious.
The stent can suddenly block off, causing buildup, and you want to prevent that. So if you have, before you go out of the country, you do want to make sure that you have insurance just in case something may happen.
One more question. What about his Flonase? Did he continue to take that or what?
Okay, so there are no contraindications for Flonase, so you can resume taking your Flonase immediately.
All right. One more question, actually. He's getting kind of old. Any suggestions on his home care for his deteriorating health?
Okay, so his health, everything should be back to normal within a few weeks. Some things you could do would be to avoid clutter. Make sure the areas are, well lighted. You're gonna want to make sure he's compliant with his medications, and you can incorporate maybe 15 to 30 minutes of exercise a day.
Okay.
Any other questions?
No, dear.
All right.
I just want to confirm that all this information that you've just given me, not that I don't want to forget anything, is it on my discharge paperwork?
Yes, everything is on your discharge paperwork.
Okay.
You also have 2 follow-up appointments. One with Samantha Hart, cardiology, on 8/31/2020 at 9 a.m. and then you have another with James Cricket at Internal Medicine on 9/7/2020, and that one's at 10 a.m.
Do I need to write that down, or is that on the paperwork
It's
too?
also included into
It's
your
in here,
discharge
it's in here,
paperwork.
Dad, it's in here.
Yes,
Thank you.